soft tissue stabilizers of the shoulders provided by the mainly posterior capsule, thin less than 1 mm with no ligaments. Rotatory interval. The contractures of the rotatory interval is seen with adhesive capsulitis, also called as frozen shoulder. If laxity of the rotatory interval results in visible sulcus sign with the inferior laxity with the shoulder in adduction. Includes the contents of the rotatory interval is include capsule and superior glenohumeral ligament and coracohumeral ligament and long head of biceps tendon that bridges the gap between the supraspinatus and subscapularis. Boundaries mainly bounded by the rotatory intervals is medially by the lateral coracoid base, superiorly by the anterior edge of supraspinatus, inferiorly by the superior border of subscapularis, and laterally apex formed by the transverse humerus ligament. The rotatory cuff is provide dynamic stability. The primary biomechanics role of the rotatory cuff is stabilizing the glenohumeral joint by compressing the humeral head against the glenoid. The biceps of long head also provide dynamic stability. The long head of the biceps act as the humeral head depressor. Variable origin from the superior labrum from the weak link that predisposed to the slap tears. Superior glenohumeral ligament and subscapularis through thought to play a role in stabilizing the long head of the biceps. Coming to the osteology, the humeral head, greater and lesser tuberosities are attached sites for the rotatory cuff. Spheroidal in shape in rotator head in 90% of individuals. Average diameter is 43 mm. The humeral head retroversion is 20 degrees from the transepicondylar axis of the distal humerus. Articular surface inclined upward 130 degrees from the shaft. The glenoid. Pear-shaped surface with average upward tilt is 5 degrees. Average version is 5 degree of retroversion in relation to the axis of the scapular body, varies from the 7 degrees for the retroversion to 10 degrees of the antiversion. Coming to the coracoid, serves as an anatomical landmark lighthouse for the deltopector approach. The coracobrachialis pectoralis minor, short head of biceps attached to the coracoid. Coming to the acromion, acromion is 3 ossification centers, meta, meso, and preacromion, like base, mid, tip. Acromiohumeral intervals is normally 7 to 8 mm, and acromiohumeral interval may be normal on X-ray but decrease on the MRI when patient is supine and weight of arm is removed. This is usually signifies multiple tendon tears. The morphology of acromion based on 3 categories. Type 1 is flat, type 2 is curved, type 3 is hooked. Coming to the blood supply of the humeral joint, humeral head according the main branch is ascending branch of the anterior humeral circumference artery and arcuate artery. It provides blood supply to the humeral head. Vessels runs parallel to the lateral aspect of the tendon of the long head of the biceps in the biceptal groove. Beware not to injure when the plating proximal humerus is fractured. Arcuate artery is the interosseous continuation of the ascending branch of the anterior humeral circumflex artery, penetrate to the bone of the humeral head. The posterior humeral circumflex artery, most current literature supports this as providing a main supply to the humeral head. Coming to the arthrodesis, the shoulder arthrodesis optional position is 15 to 20 degrees of abduction, 20 to 30 degrees of forward flexion, 30 to 40 degrees of internal rotation.